My name is Sharon. I live in Indianapolis, Indiana, but I'm originally from Lafayette, Indiana. That's where my family is. I have just been really dumbfounded about working with people in the medical field about how they treat people with disabilities. This summer has been pretty bad for different tests and things. And I know my body pretty well. So when we go into somebody new, like a tech for x-rays or PET scans or MRIs or CAT scan, obviously I've had a bunch of some, they tend to say, well, what can we do? And then they don't listen to you. And then they want you to do things the way they're used to doing them. And I always take somebody with me, one of my helpers, if I have to be lifted, because I don't trust those people to lift me, because they're used to people being able to bear weight and walk and that kind of thing. They have very limited training about how to interact with people with disabilities. And then when I have to go see new doctors, I would take them information about my disability, but I will also take them a resume, because I want them to see me as a person of worth, that I am a productive person, that I am worth their time and their treatment to make me better. You know, if I didn't want them to make me better, I wouldn't go to them. So, I had to deal with that quite a bit. Sometimes people are very surprised when I give them the resume, and sometimes they're very pleased, because it's like it kind of helps us over that hurdle of them not quite knowing how to respond to the disability. So I'm breaking the ice. I'm saying, yeah, I know I have a disability, and, let's deal with it and go on and get past that. To help medical personnel to treat anybody with a disability, and probably just anybody in general, first off, they need some education and people skills. And I think they also need some really intense training about people with disabilities and different disabilities. I think because they're in the medical field, it is assumed that they know how to deal with people when they really don't. They really don't. So I think if we as a disabled community could do something, training or something, maybe we need to give scholarships to conferences to medical personnel to encourage them to mingle with people with disabilities and get to know us as real people and not patients. Maybe that would help. I don't know. But there's got to be a better answer than what we're doing now. I have found that humor works sometimes. I have found that talking directly to them, like when they come in saying, hi, how you doing? What's new with you? How you feeling or whatever, kind of puts us more on an even table, when they come in and sit down. Humor's always good, They do something, make some kind of joke or whatever. Not to be sarcastic or smart, just be funny. It is really depending on the medical personnel, because sometimes they just don't get it, and you'll know within a few minutes that they don't get it. So then you just go back to kind of being a patient and hope you can get out of there as quick as you can. Medical knowledge of disability in the medical field is so awful. They don't know. They don't know. They see, they think everybody's the same. I think they think everybody's a spinal cord injury for some reason. I don't know why that is. But we're not. I'm not. Most people I know are not. And that's a good point. I don't know why they like to lump us all together. That we all have the same needs and problems, but we don't. We're just people, individual people like everybody else.